Good morning, everybody. Happy Saturday to you. How is everybody? Yes, it's warmer here today. I just got done working out and it's only 4 below. It actually feels like a heat wave. Wind chill is minus 16-ish, so much better than minus 36. So yes, today is a heat wave. So those of you who live in Iowa right now, you're probably wearing shorts right now because it feels like a heat wave. So we are live right now on Instagram and YouTube. And for those of you who do not know me, I am Dr. Malea Jensen, and this is Dr. J's Prescription for Health. We do this every Saturday and Sunday, Saturday at 9 a.m. Central and Sunday at 10 a.m. Central. So we're waiting for the YouTubers to jump on, but you Instagrammers, if you have questions, I would love to hear them. This is your opportunity to ask questions, medically related, hopefully medically related, and we'll go from there. I did have a question that was a leftover from the chats on Instagram, and I wanted to go over that one. And it was, they wanted my take on, go lay down. They wanted my take on slightly elevated blood pressure. Now, I don't know what slightly elevated blood pressure is, but let me tell you what the guidelines say right now. The guidelines are sitting right around 140/90 as the upper limits of what they consider normal. I've even seen 135/85. Now, it's fairly close. So is slightly high 140/90? I would want to know medications that you're on. I would want to know BMI or, just some more vital signs. How about that? I would want to see your labs because maybe slightly high is okay. Or maybe slightly high is a detriment. We don't know without much information, but I'm still learning. I'm not completely on board with the fact that everybody needs to be at 120/80. I think we have some caveats that we need to take into consideration. When we lower blood pressure too much, we have to think about the heart's ability, or our fourth phase of water and the electrons and everything. How about this? We have to take into consideration that we need blood flow to our organs. If the pressure's too low, could that be a detriment to getting blood to our organs, like our brain? Okay. We have to be very cautious about lowering people's blood pressure, making them dizzy, and increasing their fall risk. There's a lot to take into consideration. So I would want to know more information from that person. Cotwell says, hello, I am in the United States. I am in Iowa. Well, it's morning here, so good morning to you guys who are joining on YouTube. I appreciate you being here. All right. Oh, here's a good question. Here is a good question. What is the difference between metabolic syndrome and insulin resistance? I think that's a great question. Metabolic syndrome, there are 5 markers, 5 variables when we as physicians talk about metabolic syndrome. And there's 4 highs and 1 low. The highs are, so high blood sugar, usually over 100 fasting. High blood pressure, again, that's that 140/90 or 135/85. Okay? High triglycerides, they will say over 150. I say over 70. Triglycerides over 70 are a risk factor for cardiovascular disease. And high waist size, meaning an abdominal obesity. The low would be low HDL. So anytime triglycerides are elevated, HDL is going to be low. When we lower triglycerides, HDL has a tendency to go up. HDL goes up with exercise. HDL will go up with increasing amounts of animal saturated fat. So I have seen tremendous increases on people who go with high fat, moderate amounts of protein, and low or no carbs. And their HDL, not skyrockets, but it goes up considerably, okay? Triglycerides on this type of way of eating it goes down tremendously as well, okay? Now, the difference with insulin resistance by definition is hyperinsulinemia, so high insulin in your blood, along with insulin resistance, meaning the cells have basically closed their doors to taking in any more energy. They become insulin resistant. Something could be wrong with the cell membrane, something could be wrong with the GLUT4 or any other receptor that takes in energy, GLUT4 being the most common. Insulin talks to the receptors from the inside to the outside. So the receptors are inside, and when they see that energy is wanting to come in, they go answer the door basically, okay? Yeah, Troy, we are not really talking about diabetes. We're talking about the difference between metabolic syndrome and insulin resistance. And I went over the 5 markers of metabolic syndrome. And I'm now discussing insulin resistance, and by definition, it is hyperinsulinemia and insulin resistance. Over time, insulin resistance is diabetes. I always like to tell my patients that you could have insulin resistance or hyperinsulinemia for years before diabetes actually shows its face to the doctor, because the doctor is giving the diagnosis. The doctor might be like me and say 6.0 and above is diabetes. Where you could reach another doctor and they'll say, oh, you know what? You're fine, 7.0. You know, once it reaches over 7.0, you got diabetes. Well, to me, 7.0, you've lost 40 to 50% of your beta cell production of insulin. You've waited too long, doctor. You should have been telling this patient that they had diabetes long before that. At least call it pre-diabetes if you want, but they're not even doing that. And in all reality, there's no pre-diabetes. We're all pre-diabetes until we get diabetes. How about that? So I don't like to use that definition. You know, it's just a difficult definition to work with. But I could look at the metabolic syndrome definition with the 5 markers, and I could say to you, if you have high triglycerides and you have low HDL and you have abdominal obesity and you have high blood sugar and you have high blood pressure, you have insulin resistance, if not diabetes. Okay? So they go hand in hand. They are not the same. By definition, they are not the same. But physiologically, they lead to the same thing. Okay? Snowman says, do you do any physical activity? I lift weights. I lift weights every day. Not every day. I will take some days off. And, I didn't even see, I have Lucy here as my moderator. I appreciate it. Lucy, if we could work on and maybe talk to the other moderators that, unless it is blatant, let's maybe give them a little bit of a warning and say, hey, that is not appropriate for this. I did place in the description the rules or regulations or what, it seems like YouTube needs to have these rules and regulations, whereas Instagram does not. I don't know what the difference is as far as the maturity level, but that's what we're seeing. So Lucy, if it's not so blatant, maybe give them a warning. And if that doesn't work, then Then you do your thing, okay? I really appreciate you being here. Okay. Okay, wait a second here. She one says, how much water do I need to take with 5 grams of creatine? I don't know that there's a concrete answer to that, she one. However, I will say this. I think you need to drink water when you're thirsty. Yes, if you are taking creatine, you do need to take it with water. You could take it with a glass of water, but I think over the day's time, you should be drinking when you're thirsty and don't hold back. So water is good for you, but overhydrating is not so good for your kidneys. All right? Let's see. Ruth asks, if one slips on the ice and sprains their wrist badly, should they just lift with the other side? Yes, you should maybe see the doctor and make sure you don't have a fracture. You can put your wrist, your hand in a cock-up splint. It's, those beige or tan splints that go on your hand and wrist. They have a little Velcro, but they have a piece of harder material, usually a piece of metal, and we call it a cock-up splint, and it stabilizes the hand and wrist. Thank you so much for the gift. I really appreciate that. Is that Jesus? I really appreciate that very much. So should you lift with the other side? Absolutely. Lift with your legs. Don't do anything that hurts. Let it heal. Okay? Maybe stay away from the ibuprofen or any NSAID that you usually, if it's acutely, you can take ibuprofen. But if it's been going on for 3, 4, 5 days, no, I don't think that you should be taking NSAIDs. It actually decreases the healing time. Thank you, Lucy. I appreciate that. Leading healing. I wonder if I overhydrate, but I drink when thirsty. Here's how a good, your urine. We used to tell patients that your urine should be clear or white. And after much learning and much research, I would suggest that your urine should be straw colored. It should be a light yellow. And that would tell me that the kidneys are working just right to concentrate your urine. If your urine is clear to white, your kidneys are working overtime to try to concentrate that urine. And over time, that weakens the kidneys. That causes a lot of demand on the kidneys when they could be doing a lot of other things. Okay, so be very conscientious about that, all right? Okay. Hey guys, here's a nice break, but if you have not liked or subscribed to this channel and you find it interesting, please do so. Click that thumbs up, click the like button, subscribe. That I would really appreciate it. Oh, much love to you as well. Oh, it is Jesus. Jesus saved Javon. I didn't see the whole, so I appreciate that. Jesus saved Javon. So Javon, thank you so much. I appreciate it. Let's see. I'm scanning for questions. Troy made an interesting point to Shiwan. If you're a guy, you should be drinking up to 4 liters of water with creatine. Troy, can you help me understand or where you're coming from with that comment? Is it something that you've come across that I should know about? Because I would really like to know what your thoughts are on that, okay? So hopefully you can get back to me on that. Is coffee good or bad for blood sugar and insulin? Oof, that's a great question. Coffee can be good and can be bad. How about that? When I want you to picture this. When we are drawing fasting labs, we tell the person not to drink coffee prior to their blood draw. Why? Because it can elevate triglycerides. It can change blood sugar. Why? Because it activates our sympathetic nervous system. When our sympathetic nervous system is activated, it causes gluconeogenesis or glycogenolysis. Either way, blood sugar can go up. If you are insulin sensitive, meaning you don't have any problems with that coffee increasing your sympathetic nervous system, all is well. If you are already insulin resistant, meaning you are not insulin sensitive, coffee could be a detriment by raising blood sugar, which raises insulin, which worsens the problem of insulin resistance. Does that answer your question, Iman? I really appreciate your question. Thank you so much. Oh, so Troy is giving us a little information. He's 56 years old and just found out a month ago he's got diabetes type 2. So, Troy, your coffee, or no, that was Eman. What was your... Troy, actually, now I'm going to go a little bit deeper on your question. If you are a type 1 diabetic, your kidneys are already they're challenged already. They are already working very hard to try to get rid of sugar and concentrate and make sure you're keeping sodium. And the sodium potassium pump is going to be off in you, Troy. For you to be drinking 4 liters of water, it would not be in your best interest. You are really stressing your kidneys, okay? Thoughts on celiac disease? It's inflammatory. What is your, let me know what your question is. Good, God bless you too, Javon. Javon, spreading the good news. Yeah, the good news is the gospel. I agree. Thank you. Best advice for constipation. The best advice is to find out why you're constipated and if you're truly constipated. Constipation is not simply just having regular bowel movements, okay? Constipation, by definition, is having symptoms of constipation, whether it be cramping abdominal pain, bloating, gassy. That is my definition of constipation. To say that you have constipation because you don't have a bowel movement every day, but yet don't have any symptoms whatsoever, is not constipation. So, Ruth, if you truly have constipation, the side effects of which, is usually a crampy abdominal pain, bloating, gassy, then I would look into what is causing your constipation. If that's the case and you want to discuss it more in a consultation, I'm available. You can email me at IronLadyDoc@AOL.com. Okay, thank you. Kendra asks, keeping in mind your suggestion to avoid NSAIDs, NSAIDs when we have a fracture. NSAIDs in general, we should not be relying on medications. We have inflammatory problems because of an underlying condition. By simply just taking NSAIDs, we're causing more problems, okay? So we got to find the root cause. So keeping in mind I don't think that we should take any type of medications for inflammation until we find out what the inflammatory cause is. Now, Kendra is speaking in general about Ehlers-Danlos, which I have seen one patient in my 27 years who has Ehlers-Danlos, okay? They're hyperflexible, and Kendra is saying that they dislocate 2 to 4 times a month. I don't know where they're dislocating. Could be hands or could even be your lateral epicondyle. I'm not sure what you're dislocating 2 to 4 times a month. But then you go and take NSAIDs for, for the pain management. I have seen, and I'll take this with how you would like it, but I have seen people who are on a ketogenic diet, keto carnivore lion diet, actually improve their symptoms of their Ehlers-Danlos, and actually minimize the amount of dislocations or the amount of pain that escalates from that condition. It's been amazing. I've read about it. Again, my one Ehlers-Danlos patient will not probably, because they are carb lovers, they will not take up my suggestion. Yeah, we can't be calling coffee bad. It's true. And it didn't finish off. Zaki asks, ma'am, how do you get rid of ear pain? I would ask Zaki, what is the cause of your ear pain? And that might be able to help me. But you need to really see your primary care doctor to have a good evaluation of your ears, okay? Let's see. Okay, Laura asks a very good question. What are your thoughts about the theories? I'm glad she said that. It is a theory. It is when we are trying to prove something, people say, well, follow the science. Science is actually moving all the time, as it should be. We hypothesize something, and then we form a theory, and then we prove that theory right or wrong, and then it becomes, more ingrained. But I'm getting into the weeds on this. But Laura's asking about the long-term low-carb or keto down-regulating your thyroid. Good question, Laura. T3, the active form of thyroid, can go down on a low-carb keto carnivore diet. T3 is involved in the metabolism of carbs. So the reverse thought of this, the other theory, the other side of this coin is we don't need as much T3 because there are no carbs on board. Therefore, it's not really down regulating your thyroid. Your thyroid is basically hibernating. It's in a resting mode where it doesn't need to do as much. Whatever T3 you have is just enough. I would look at all of your thyroid, the TSH, free T3, free T4. I would get your antibodies, TG and TPO, and I would get a reverse T3. I would want to know a big picture of what's going on with your thyroid. And how do you feel? We get a lot, everybody likes to scare people away. Laura, the people who are going to tell you that the thyroid is downregulated are likely on the vegan, vegetarian side of things, and they're going to scare you about your thyroid. If you are having symptoms of thyroid condition, hypo likely, if you're worried about downregulating your thyroid, you're worried about hypothyroidism. How do you feel? Are you tired all the time? Are you able to sleep? Is your skin dry? Are you constipated? All of the signs of hypothyroid. Are you cold all the time? Although that could be iodine. I mean, there's so many things that when we simply look at just one value like TSH, we're not getting the whole picture. I believe that many people are deficient in iodine, and our thyroid is not going to produce hormones without iodine. Okay, it's not going to work. Moose, I'm going to mess up this. I'm going to say Moose. Moose is diabetic and drinking coffee. I think coffee is probably the least of your worries right now. The reason you're diabetic is not because of your coffee. It's from the other foods that you are consuming, most likely. I don't know what you're eating, but a type 2 diabetic is eating more carbs than they can process. And we, by definition, only need 5 grams of sugar in our bloodstream at any one time in order to thrive and survive. Russell says, 50 years ago, I was beaten and left with permanent hearing loss. Do you think modern tech could now fix such an old injury? I'm not sure. I'm not sure what part of the inner, did you have an inner ear crushing mechanism? I'm not sure what an ENT would advise, but I'm not able to advise on that. Thank you for the question, though. Hausa Ambertone? Okay, sorry. Because y'all don't drink Italian coffee. I quitted, by the way, at least 6 months ago. Greets to your channel. Well, greetings to you as well. Thank you for, no, I've never drinking Italian coffee before. That would be interesting. Kelvin says, just got my blood work done and my A1C went down from 7.5 to 5.2. Kelvin, that's amazing. How did you do that? Let us know, Kelvin, how did you do that? Hannah asks, are you getting hit by a winter storm? We are not. We've had some light snow this morning, started around 4 a.m. and it's just enough to coat the streets. But the cold is what we are having concerns about, okay? The cold has been cold. Yesterday was the coldest day, and like I said, when I opened my live stream today, it feels like a heat wave because it went from minus 36 wind chill to minus 16. So it does feel like a wind chill, and I could see people, and this is Iowa, when this happens, when we have a cold spell like that, a very cold spell at minus 36, and we go to a minus 16, you will see people wearing shorts to the grocery store. Now, would I do that? Absolutely not. But when we have a change in temperature that much, it seems like a heat wave. Okay. If you are on Instagram and you asked a question and I did not see it, please ask it again. Leading Healing says, my grandma had diabetes. My mom has had JT 2 years. I found out this. I do even if my kidneys are okay. I keep checking because my spouse, my dog, and a few others I want to live on or I'd be okay. There's a barrier with your English, and I'm sorry, I'm trying to, if you could ask the question again, I would appreciate it. Cameron says, appreciate all the type 2 diabetes information. Let me see. Angel says, I was diagnosed with pan-hypopituitarism. I was supposed to take my meds my whole life, but years ago I stopped. Everyone yelling at me, but I'm still kicking. Angel, if that feels good and you're the maker of your, just as long as you have informed consent and you have enough information to make a good decision, then we're all good with your decision, okay? Eldon says, what herbs would you recommend for general health? Good morning, Sheila. I do not recommend any herbs. I recommend eating a, as Dr. Berry would call, a proper human diet. Okay. Richard asks, are you a medical physician? Yes, I am. I went to medical school. I am a DO. I went to an osteopathic medical school in Iowa. Virginia asked, Dr. J, how much iodine is too much? I don't know the answer to that. Some are saying if you take too much that you will pee it out. I agree, it's water soluble. Some say it could mess up with your thyroid. My son is taking 6 drops of Lugol's 2% and hasn't gotten labs. I think with 6 drops, your son is A-okay. Now, I have not seen his labs, but I'm guessing that low amount. There is, Virginia, there is an awesome book. It's by Dr. Bernstein, I believe David Bernstein. Look that up. It's on Amazon. It's a great book about iodine. Moose says, what about coffee and milk? Type 2 diabetic. I probably would skip the milk. You could. Now, dairy is very controversial, but if you are a coffee and milk person, have you ever considered going to cream? Whole, grass-fed, organic cream, whole cream. It's going to have less sugar, is why I'm saying that. So maybe switch your milk to cream, whole, heavy cream. Hello, Fabian. Thank you for being here. What does low CO2 on a blood test mean? It has to do with our acid-base balance, and I would need to look at your other blood tests, like a CBC. You could have problems with your iron. You could have iron dysregulation. You could have macrocytosis. Your red blood cells could be large and unhealthy. They aren't delivering oxygen to your vital organs as well as they could be. So there's a lot of other things. I would want to look at your liver function, your kidney function. So just by itself, I like to see a CO2 on a complete metabolic profile between 24 and 26. That's the sweet spot for me when looking at a CO2. Let's see. Carrie says, everything improves in ketosis. So many things have gone away I didn't expect. Carrie, that is awesome. If you can share some of the things, many things, that have gone away when you started a ketogenic diet, we would love to hear. Secret says, I've got stomach pain, so what herb I need to drink? Secret, I cannot recommend any herbs. I would want to know what is causing your stomach pain. Okay. William says, Doc, I have a question about my blood work that I got results on. Nothing bad, just a question. Okay. William, I would be happy to try to answer your question, but if it's, going over your labs is something that I love to do. If you would like to schedule a consultation, just email me at IronLadyDoc@AOL.com. Iron, IronLadyDoc @AOL.com. Lucy, if I haven't already thanked you for being here, I really appreciate you. Okay. Sammy says, God bless you. God bless your voice. And I'm still in my wheelchair and wanted to say hi, before I'm transferred and your voice helps you star. Well, Sammy, thank you for your kind words, and be careful with the transfer. Hopefully you have help. I remember, it brings me back memories when my dad was needing help transferring from his electric chair that, went back and forth. After a while, he couldn't even run that, and we had to help him. But the transfers were always, always difficult, because if you've never transferred somebody who's absolutely dead weight, and my dad was maybe 135 pounds, it was very difficult. But it's a technique, and I learned it quite well. But occasionally we had to use the harness on him, which is another electric device that helps to hoist. It's called a hoist, or a transfer apparatus that helps to transfer people. And I took several pictures of my dad in that apparatus and showed it to him, because he didn't know, and he kind of giggled over it, because it's kind of like a little cocoon that they put you in just to move you from your bed to the chair and back to. No, it's hard for a child or anyone to see, but my dad was such a trooper. Oh my goodness, he was such a trooper. He just, he adored me, and I adored him. And it was, if I could, every single time if I was there, I moved him as best I can. And a lot of times I would just grab somebody and they would help me, because waiting for the nurse to come in when there's one nurse to 30 people, it's devastating. So I had a good technique. So be careful with that. Calvin says, a lot of tirzepatide and glipizide. To get your A1C from 7 to 5.2. Remember, glipizide, just so you were aware, Calvin, is a sulfonylurea, and sulfonylureas cause even more beta cell burnout. So you're actually increasing, you're almost like taking insulin, Calvin, with glipizide, with a sulfonylurea. That is a very old medication. What's in your best interest is to actually get rid of carbohydrates, that you don't need glipizide, but you're worsening beta cell burnout. You're causing your kidneys, I believe, to fail faster than they normally should. You spend $1 million on tirzepatide and yet spend $3 on glipizide. It seems like an odd combination. Kendra says, I hate the pain way more than I love carbs. I'll be trying carnivore. Oh my gosh, I can't wait to hear, Kendra, if it helped. Give it 30 days, please. Do not, and go slow, go slow, and make sure you're getting enough salt. If you're going to go cold turkey, make sure you salt your food. Cameron says, can you reverse diabetes without meds? Yes. Or, no, that's not an or. Is it a total diet change? It is. It is a total diet change. And no, you do not need medicines. Although if you've tried the dietary change, really tried it, and, and your A1C does not come down, I would suggest that there's other things to look at. Good morning, Retail My Ride. I appreciate you being here. Sammy says, I pray you know and remember. I didn't, Sammy. I apologize about my neck being so badly broken in my accident. And I'm now diagnosed with C2 complete quadriplegic. I'm ventilator dependent. Now I'm remembering. Sammy, I do remember now. This is devastating. And I appreciate you being here listening to us. Oh my gosh, that's awesome. But no, I totally forgot. And thank you for the reminder. And I might need a reminder again. And please do not take offense to that. It's hard for me to remember everybody. But now that you say that, I do remember. I do remember. You just keep being a trooper, okay? Okay, William, that's fine. You can wait and ask. Ryan says, Ozempic got my A1C down. So are you still on Ozempic? Is Ozempic a lifetime medication for you today and then for the rest of your life? Why is it that Ozempic got your A1C down? What was it that got your A1C up, and did you get rid of whatever got your A1C up? That is my question to you. Hi, Daryl. Welcome to the channel. God loves you. God loves you. And I'm sorry, but yes, God loves you. Catherine says, does liver scarring evidence on a CT automatically garner a diagnosis of cirrhosis? No. But how about this? On a CT scan, you need to get a fibro score. The scarring could simply just be fibrosis. And the more and more fibrosis leads to cirrhosis. So it needs further testing. I don't think that it is complete evidence that you have cirrhosis. And even with that said, I have seen people reverse cirrhosis with a ketogenic diet. Okay? It's been amazing. Okay. Okay. Anandan says, I feel lethargic all day. Probably need some labs and look into that. Have you seen your physician? Fabian says, I'd like to travel and come see you and be checked out. Well, Fabian, I close my physical practice and I only do online medical consultations. But thank you for for the value I give to you. I appreciate that, Fabian. I cannot remember where you're listening from. Can you let me know? Where are you guys listening from? What city, what state, what country? Thank you, Bobby. That you're very kind. I don't think I'm the most beautiful doctor in the world, but in your eyes, I must be, and I will take that as a humongous compliment. So thank you. What are my thoughts on mushroom coffee? I don't really have any thoughts. I would not drink it. Me, not you. I would not, if I was you, drink it. It's just I try not to put any of those plants in my body. If I'm going to drink coffee, I'm going to drink a low oxalate organic coffee. Organic for sure. Sometimes it's hard to find low oxalate coffee, but no, I don't. I gave up all the mushrooms and all of the supplements. I don't take anything anymore. I take some iodine. I take, off and on, I'll take creatine. Off and on, I take citrulline malate. What else am I taking? That might be it. I said the iodine, yeah. Yeah. I used to spend, I bet, a couple $100 a month when I was really working. I bet I spent a couple $100 a month on supplements. For years, I was really into natural or alternative medicine. I don't want to say naturopathic because they're not always like that, but I want to say I spent a lot of time studying alternative medicine, a lot of which I have actually forgotten. I would need to be reminded because there's so much to learn. But I did give up mushrooms. I gave up all root plants. Yeah, anything that grows below the ground, completely gave it up. Okay. Virginia says, thank you for answering my question. Appreciate you and have been recommending your channel to other carnivore keto friends. Virginia, I really appreciate that. Please share and like and hit the subscribe button. Support my channel as best as you can. That would mean a lot. So whatever you can do to help, that really means a lot. Laura says, Dr. J, I've been carnivore since 2024. A1C is 5, excellent. Fasting insulin 3, excellent. So between 3 and 5 is a great level for insulin. Yet I have difficulty building muscle and shrinking abdominal fat. What could possibly be the cause? Oops. I tried deficit. Not sure what you meant by that. Maybe it's in a further comment. No, I don't see any further comments. I would have to unpeel that layer by layer. I don't know how old you are. I don't know what your other labs are. You could, Laura, I'm just throwing this out there, even though I've tried calorie deficit, please don't do that. That will actually increase your risk of retaining abdominal fat. Remember, when we go into a calorie deficit, your BMR, basal metabolic rate, your metabolic rate will go down to try to conserve. So you will break down less fatty acids on your ketogenic diet, and you will stress the sympathetic nervous system to increase cortisol production. And cortisol will trigger the glucagon release, which triggers the liver to make more glucose or break down your glycogen stores. I don't know, where you're at in your life. Having a little bit of abdominal fat is okay. Again, I don't know how much abdominal fat you have, but Laura, being a woman, we are not going to be, as much as I would love to have a six-pack like I did 15 years ago when I was dieting for shows, I'm probably not going to have that six-pack again. Unless I completely did not eat. I have tried OMAD. I eat when I'm hungry. I will eat when I'm hungry. I don't have a set time that I eat. Like today, I might not eat till noon, 1 o'clock. And I might eat again or I might not. It just depends on how I feel. Today, I didn't have time to eat before this session, nor was I hungry. We have this thing in our mind where, and oh my gosh, so many people have told me this. They've admitted to me that they are so scared of when they're not knowing when they're going to get their next meal, that they will eat a whole bunch in order to be like a hibernating bear, because they're so scared of not getting a next meal and being hungry. They're so fearful of being hungry that they will overindulge to fill up so they won't be hungry later. It does not work, because the foods they usually choose are carbohydrates. Carbohydrates will spike glucose, and then insulin will be secreted by the beta cells in the pancreas. That will lower blood sugar and almost completely bottom it out, okay? Because these people are insulin resistant. They shoot out more insulin than they actually need for whatever they're eating. And so hyperinsulinemia will cause blood sugars to plummet. It would be like you, as a type 1 diabetic, injecting 20 units when you only need 4 for what you're eating. So you will turn around and eat a whole bunch of food to try to get your blood sugar back up. So you will get hungry. Your insulin drops your blood sugar. It will basically tell your brain, like put your brain into fight or flight. And it tells you to eat right now. Right now, it will tell you to eat. But you choose to eat a carbohydrate instead of fatty red meat, which would elevate your blood sugar. But again, for me, eating when I'm hungry, which seems to be 2 meals a day right now. Today, it might be 1 meal a day. It just depends on what the day has for me. I eat each meal till I'm comfortably full. And a lot of times I don't need another meal, but that can be a detriment, not to me, because I know what's going on. What I mean by that is I want muscle. When I start seeing muscle deteriorating, it tells me I'm not eating enough. Enough of what? Protein. Most women are not eating enough protein. Most women don't even eat enough calories in general as they get older. Okay? So if you are on your carnivore diet, I would suggest to you that you might be undernourished. You're eating nutrient-dense foods, but not enough of them. So your body is holding on to that abdominal fat. You could, one at a time, increase your fat intake. If you're at 100 grams of fat a day, maybe you increase it to 150 and see what that does to your abdominal fat. If it does nothing, then lower it back down to your 100. I'm trying to get back to where we're at, and then increase protein. Maybe if you're at 100 grams, you go to 150 grams of protein, and see if just changing these things will spur your body into not feeling like you're a hibernating bear and conserving. Your basal metabolic rate, your metabolic rate is probably a little low. Again, I don't know how much fat you have on your body, but having an inch of fat, that just a little bit of fat that you can squeeze might be in your best interest for longevity. Being a six-pack might not be in your best interest, okay? Even though you might not like the look of it, all right? Thank you, Lucy. I appreciate that. Kendra says, do you mentor other providers? I used to. I used to take students all the time in my office. I really enjoyed teaching. I love to teach students, but now that I'm closed my physical office and only do online consultations, I don't mentor anyone. But I always suggest that my online doctor, I call them my online doctor friends, they mentor me, because I've only been really heavily involved in this presence online for 3 years. Prior to that, I have a lot of lived experience with bodybuilding and low carb diets. It's just that I'm adding more and more and more knowledge to my baseline. It's been an amazing journey. I've learned so much. So many things we were never taught in medical school. So many things we were taught in residency. So many things I never learned while I was seeing patients. I didn't have time. I didn't make time to study until probably 2019, 2020, where I really dove in, okay? I took the time. I put some other things on the back burner, and I took the time to improve my knowledge base, okay? It's been an amazing journey. And that's why I like to share all of these things with you guys. I enjoy teaching. And if you guys feel that something I say is not right or it doesn't align with you, be nice. Tell me in such a way that, hey, you just said this, and I'm not sure if you're right or you're wrong, okay? I read this. Can we talk about it? Do you see how much better that conversation goes instead of saying, doctor, you said something, I think you're wrong, and show me the evidence? I am likely not going to respond to that. That does not feel good to me. I could be wrong. I'm not denying that. But let's use a different language when we're trying to learn. You might be wrong too. We might both be wrong. How about that one? There might be a right answer that neither one of us know about. So this is a journey that you and I, all of you, we are learning together. I don't know it all. That's why I'm continuing to learn. And that's why you guys are here. There was a comment that was on my Instagram post who said, when I go to the grocery store, I look at the parking lot all packed full of cars. And then I go inside and I see what's in people's carts. And no wonder our population is overweight, heart disease, diabetes, blah, 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 Alzheimer's, blah, blah, blah. Okay, good eye. But then they also allow themselves to get frustrated. They don't know anything. If they only knew. Again, I try to point out that if a person does not want to change, there is nothing, you person in the parking lot looking at all the cars and then going inside, there's nothing you can say to make them want to change. They have to want to change. They're not the people who are listening to me and Dr. Barry and Dr. Chafee and Dr. Berg and whoever else, Dr. Kendrick. They're not doing that. They don't care. So you're actually expending so much energy worrying or trying to tell somebody who doesn't care. Yeah, but they're the ones that are increasing our insurance, and they're the ones that are using up the healthcare dollars, the government. Oh, they're not the only ones. But we can only speak to the ones who want to hear what we have to say. It is what it is. 20 years ago, you probably couldn't have talked to me. I thought, you got high cholesterol, here's your statin. I'm going to protect you from having a heart attack. Did it help? When I look back 27 years, no, they still had heart attacks. Why? They had diabetes. They had high blood pressure. They had insulin resistance. Did I know that? No. I didn't even check an insulin. I didn't even know to check an insulin. But I went with the brainwashing. I went with it full force. Because why would they lie to me? Oh, they weren't lying. They were just telling you what you needed to hear. But it's not the case. Okay. If it's not the case, then what is the case? What is the cause of a heart attack? If it's not LDL. I didn't say it's not LDL. I'd say maybe it's not all LDL. There's nuances here, and we're still learning. If I tell you that I think that small, dense LDLs might be involved in plaquing of our coronary arteries, I might be wrong in a year or two from now. I don't know. But right now, I'm on board with sticky, oxidized, small, dense LDLs as a culprit to plaque formation. Did they cause the plaque formation? I can't get on board with that yet. There are a lot of other things that I believe are damaging the lining of the arteries and leading to Band-Aids being produced, i.e. plaque formation. But if I look at everybody who had a heart attack or has coronary artery disease, I would venture to guess at some point in their life, they may not be right now, but at some point in their life, they were insulin resistant or diabetic. Okay? I'm going to hang my hat on that hook right now. Okay. Let's see. William says, I have an LDL of 101, HDL of 58. Lab says LDL should be below 100. Is the lab your daddy or your mama? Why are you relying on somebody telling you, like a lab, who says your LDL should be below 100? By whose standards? Who's the lab? Name the lab. Name the person who wrote that on your sheet. Do they have control over you? Or are you letting them have control over you? Your 58, William, is pretty darn great. Is 70 better? Absolutely. Should it be above 60? Maybe, yes. Your total cholesterol has absolutely no bearing on this, but you never told me what your triglycerides are. So if I know your triglycerides, I might be able to give you a little more information. Penny says, my health is getting better from what I've gone through with the old place. Good. I'm glad to hear that, Penny. Thanks for sharing. Oh yeah, I forgot Jim Rad. I forgot. Thank you, Dr. Sean Baker as well, Dr. Ellie Girard, the Natural Heart Doctor, Dr. Kiltz. I could go on and on with these names. I really like David Diamond. I think it's David Diamond. Everybody's David to me. Dr. Diamond. I like Dr. Paul Mason. Amazingly smart people. I like listening to Dr. Ben Bickman, I have gleaned a lot of information from a lot of people. I don't just stick with certain, I patron everybody. I like to learn. I love to learn. There's this one, Dr. Sarah, I just listened to her on a podcast the other day. So somebody asked me on Instagram who I listened to, and it was a pod that got me thinking about yesterday's reel. But Sarah, gosh darn it, I'll have to look it up. Nice, I think British woman. She seems she intrigues me. She's very intriguing. Lucy asked question, what is citrulline malate for? Citrulline malate is a precursor for arginine, which is a precursor for nitric oxide. Why not just take L-arginine? Because a lot of L-arginine is actually degraded in the liver before it can convert to nitric oxide. So I think taking citrulline malate in order to increase nitric oxide levels is in our best interest. For the same reason, taking nitric oxide, from what I've read, taking a supplement like that is not, I'd have to look it up, Lucy. There's a reason I have taken citrulline malate and not taking a nitric oxide. And for the life of me, I cannot put it into words. Nitrates in our food turn to nitrites, and then nitrites are the precursor to nitric oxide. With that being said, citrulline malate and citrulline comes in many forms. Malate, I have read, is the best form of citrulline that we should be taking. I probably am not explaining that very well, and I probably shouldn't even maybe comment on it, but you asked me what is it for? Nitric oxide. What does nitric oxide do? Vasodilates your arteries. Your inside the arteries is an endothelial lining, and those endothelial cells produce nitric oxide. When those cells are damaged, like in coronary artery disease, or they're inflamed, they don't produce as much nitric oxide. So where else does nitric oxide get produced? Some bacteria, like bacteria in our mouth, make nitric oxide. And if we are very hygienic in our mouth, using mouthwashes and all that, we might have low amounts of bacteria that can produce nitric oxide. If we are using up our nitric oxide on other things, like as an antioxidant to take care of reactive oxygen species oxidation going on in our body, which it does, then it's going to be used up for that and not used as healing and for the nitric oxide production that our arteries need for vasodilation. They're going to be used up somewhere else. All that nitric oxide is going to be used up somewhere else. As we age, nitric oxide goes down. Is it because oral bacteria is going down? Is it because the endothelial cells in the lining of our arteries are getting damaged? So with age, nitric oxide is going down. Should we be taking a nitric oxide supplement? Should we be taking super beets? Super beets convert to nitric oxide? A few steps. Yeah, I'm not sure if I can, if that, hopefully that answered your question, okay? Cameron says, my email is IronLadyDoc, IronLadyDoc, IronLadyDoc@AOL.com. And maybe I can pin that. I pinned Lucy to the top with my email, but there was another part of that question. Chromium. Sylvester Gemina chromium. I don't know what kind of chromium that is. And I don't know what valence that chromium is. You do not want to be taking a hexavalent chromium for sure. You want a trivalent chromium. I'm not sure that we can even metabolize it. I'm not sure if it causes toxicity in our body. But why does chromium, trivalent chromium, seem to work? It helps to manage our blood sugars. It helps us to become more glucose tolerant, more insulin sensitive. Chromium. Our diets lack chromium. Today's diets lack chromium. The modern diet lacks chromium. Do we simply go just take more chromium? I would suggest that you find out why your blood sugars need chromium. You might be consuming way too many carbohydrates. Your sugars are elevated from what you eat or your stress level. Again, I'm not big on just simply taking supplements to take care of our bad habits, our bad lifestyle. But be sure to not get a chromium 6. You want chromium 3. Okay. Thank you, Sammy. I appreciate it. Maurice says, have a good weekend, Lady Doc. Thank you very much. And you as well. What to do for a torn meniscus? I don't know how bad it's torn, Cameron. Doc wants to give me a cortisone injection. That will cause weakening of that meniscus. So if you want a surefire, rapid way to cause more destruction of the cartilage in that joint, take a cortisone injection. Cortisone is an anti-inflammatory, but it has been shown to decrease healing time and to worsen, cause deterioration of cartilage. So you have to say, is my immediate pain relief worth causing more degradation of the cartilage, the meniscus, the ACL, the ligaments, and the cartilage? You have to take that into consideration. If I would have known what cortisone or what, that did to my joint prior to getting injected, I would have never done it. I would have sucked up all the pain in the world before I would do that, because I don't want more destruction going on in my joint. Okay. Getting it every 3 months. Cameron, you're also worsening your blood sugars. I can't remember. Are you the diabetic? You're 64 years old, and he said he didn't like what he saw for surgery. You should look for a different doctor. If he doesn't like what he saw for the surgery, then he should have told you that, hey, let's send you to someone else and get a second opinion. Because I don't feel comfortable from what I see on your x-ray or your MRI. I don't feel comfortable with that. It looks like you might need a shoulder replacement. Let's send you to someone who's more inclined and knows knows more about that joint. But he's not it. And if he's giving you cortisone injections every 3 months, I hope they told you about all the side effects. I really do. Your diabetes, your blood sugars, the deterioration of the joint. Yeah, I would go on a very low inflammatory ketogenic carnivore diet, and that reversed all of my shoulder pain. All of my shoulder pain went away when I went on a carnivore diet, a ketogenic diet. Carrie says, ketosis helped her varicose veins are almost gone. That is amazing. Skin tags gone, got one left. Skin tags are a sign of insulin resistance. Cellulite, a ton better, awesome. Migraines, gone. See, very inflammatory. Our brain is very inflamed from all the carbohydrates and the hyperinsulinemia. Anxiety, gone. The biggest one, vertigo, gone. Hair, nails, stronger, more energy. The list goes on. Yay, Carrie. Thank you for sharing. Happy Saturday, Angie. Thanks for being here. You're very welcome, Catherine. Alex, it sounds like you don't want to be here. So, Lucy, let me know if that is the case. Virginia, would a doctor be able to tell what type of pulmonary fibrosis just with a CT scan? That I'm not sure, Virginia. Clarity, I don't know. Growth often costs, so there's a price, often costs the version of life people are attached to. Growth, clarity, can you be more clear? Can you give me more clarity? I'm not sure. I know this is it's a brain twister for me, so can you put it into a little bit better wording? Yes, Randy, I agree. With God, all things are possible. Dana says the average weight of a person who collects SNAP benefits is 211 pounds. I have never looked that up, but thank you for sharing, Dana. Thanks. Is it Siri? Thank you for your support from India. I appreciate it. Let's see. Is it Sarah Pugh, Carrie? A British lady? God, what podcast was she on? Is it Sarah Pugh? Yeah, maybe it's Sarah. I can't remember. She's got short pepper and gray hair. She gets right up into the camera when she talks, and she's brilliant. I just like to watch her brain spinning inside her head. She talks through things just like I do. She doesn't like blurts out these answers. She like uses her brain to think. Do these brain remembering drugs really work for seniors? I've never tried them, but I would suggest to you, why is your brain not remembering things? It's likely due to your diet. Brain fog is, I could trace it back to insulin resistance almost 9 times out of 10. Let's see. Mace, that sounds like you got a lot going on medically. Type 1 diabetic, leg amputation, gastroparesis, getting calcium infusions, iron levels at 9, been very unwell. I'm now on I got low B12. Yeah, Mace, I hope you have a really good doctor. Wow, that is a lot, and I'm sorry to hear of all this. Carbohydrate toxicity. I would get rid of carbohydrates. It will lower the amount of insulin that you will need to inject. It sounds like you might not have iron. Well, I don't know. I'd have to look at your labs. Okay. Let's see. Okay. Sounds like Praiser doesn't want to be here. Would you say, Lucy? Because they're being really, derogatory. I guess I don't need that. Flozana, this is a good question. Make sure I don't have anything over here. Lucy, I'll get to that question. I'm not sure that I know the answer about the vertical lines. It could just be your normal anatomy. But I would have to look that up on the ridge lines. What triggers eczema? Usually all rashes are all skin things are caused by inflammation, and we can trace it back to the gut. So many, if not all, skin reactions are triggered in the gut. Remember, your immune system, a big part of your immune system is in the gut. Thank you, Mike. I appreciate it. We're staying warm over here. Thank you, Lucy. I actually, I don't need that kind of talk. But Lucy's right. I am a physician, but I'm not your physician. This is not medical advice. It's for information purposes only. And you need to see your doctor, okay? I'm not your doctor. This is not medical advice for you. Okay? This is for information purposes only. I am trying to help walk you guys through some concerns you might have so you can take that information back to your doctor and talk it over. I would consider myself more of a doctor coach than I would be your doctor making decisions for you. I'm trying to help you talk to your doctor, because what I have found is that many of you are dismissed by your doctors. They don't have time. They might have a condition of ignorosis. I don't know what it is, but you're not getting what you need from your doctor. Hence, you are online listening to doctors. There's a disconnect here. So if people aren't getting what they need from their doctor, they're searching other places. They're going to other places to find out information. I mean, it's really a sad thing. I would hope that my patients felt like they got everything they needed from me. But if I couldn't give them, I would just tell them, I don't know the answer. That is a great question. I don't know the answer. Have you gone other places? Have you gotten a second opinion? Because, but I am one, I have no problem telling you I don't know the answer. I'm not going to pretend to know the answer. It actually feels good to me when I admit to you I don't know the answer. I don't have to pretend. We might just go look it up together. That feels really good, is to look it up and to talk about it, because we could look up the exact same thing and get it. You might get an answer and it'll align with your thinking, and I might get an answer that aligns with my thinking. And then we got to come back and we got to talk about it. Well, here's what you found. Here's what I found. Why aren't they matching up? And then we talk about it. And then we think logically through situations. That's what it's about. Your doctor may not have that capacity to do that with a 5 or a 10-minute appointment. And they might also have a condition of ignorosis, a condition of ignorance. It's not that they can't change. There's been times where I've had a condition of ignorance. I might still have a condition of ignorosis. It's possible. But that's why I really want to fix or to heal my ignorosis. Like, you're really, Shepherds, that is awesome. I mean, I hate to hear that you fell on the ice, but it fixed your knee. Maybe temporarily, I don't know. Maybe something was caught. I mean, it could have been your meniscus that was folding on itself and it was locking and catching. And then when you fell, you unhooked it. I mean, there's a lot of things. It could have been a loose body. We call them like little mice or a mouse, a little chip that you dislodged and you moved it and it relieved all of your pain. I don't know without looking at your x-ray or an MRI or something like that. But for right now, it's buying you time, right? I'm sorry you fell on the ice. That's a horrible way to fix your knee, but maybe it was worth it, right? Yeah, Jack, that is a possibility. Good point. That's why it doesn't look good for surgery, is because of all of the injections. Absolutely right. It caused so much. All those cortisone injections could cause worsening degeneration. And that doctor felt like, oh, geez, I'm way over my head here. And I need somebody who can actually do a shoulder replacement on that person. But again, sometimes people, they just live with what they got going on. And they got to keep movement in that shoulder area. We're not walking on the shoulder, so that's a good sign that it's taking less trauma, but if you do not exercise your shoulders or move them to get mobility, you will lose mobility. You might be able to do things in front of you. You might be able to do halfway above your head, but reaching behind you or any motions to the rear will be very, very difficult. It is important to keep active range of motion if you're choosing not to move forward with surgery. Yeah, Sean, there's a few that don't want to be here. I agree. Yeah. Let's see. Yeah, Sean, thank Lucy. She's a good girl. She's helped me out a lot. Carrie, I can look it up and I will send you a text and get you the lady. Hammerhead is from Des Moines. Well, welcome. And you are a tremendous doctor. Thank you. I appreciate that. So you're cold too. Not as cold as yesterday, right, Hammerhead? So thanks for being here. Please share. Yeah, I don't know how much you know of me, but I did close my physical practice in April of last year, so April of 2025. So it's coming up on a year that I closed, and I went completely online with consultations. And it's been a wonderful, wonderful learning experience and a great transition. It feels really good. I love to teach, and I was only able to teach for, maybe 15 patients a day, and now I can teach to 3,000 people a day. It's just an amazing feeling. Yeah, Lucy, that when there are 3 comments in a row like that, I just don't think that is called for. If it was just a one-timer, maybe, but when they just keep coming at you like that, I just don't think that is, we don't want to condone stuff like that. Thoughts on taurine, any benefits? It's an amino acid that we need, so yeah, we need it. I believe that we can get enough taurine in ruminant meats. I do not take a taurine supplement, and nor would I. I believe I'm eating enough ruminant red meat. I eat, for the most part, right now, I am eating, I believe, is mostly grain-fed meat. It is not completely grass-fed. How about that? I eat organic eggs. I eat sardines. I eat liver. I eat some chicken, not a lot. Organic chicken. I love chicken. I love the taste of it. When I make it for the dogs, and we all eat chicken, but it's not something that I will eat every day because it just doesn't have everything I need. And I would rather eat a more nutritionally dense cow, bison, buffalo, sheep, lamb, deer. I would choose that for the most nutritionally dense. Jack says my doctor is completely clueless. I'm sorry to hear that. And I probably had a few patients that said that about me at some point, okay? I'm just being honest. My patients were very delicate with me, though, when they told me that I was clueless. They didn't maybe use that word, but I got the sense that that's what they felt. And if it wasn't for them telling me in so many words that I was completely clueless, I probably wouldn't be where I'm at today. And so I praise them. Thank the Lord for putting them in my life to give me some more clarity. It feels good. Jack, you might not be able to change your doctor, and I don't know what they're clueless about, but they're in their own little world, following guidelines and following the rules that were set forth by the brainwashers. It is what it is. And that's why, Jack, you need to be the master director of your healthcare. You need to educate yourself over and above. We are not some somebody special doctors. Yes, we had a lot of education, and we paid a lot of money for that education, a lot of money for brainwashing. I call it brainwashing, okay? We were brainwashed through education, and I paid a lot for that. but God uses bad things for his good. And I believe all of that has led to the place where I'm at today, to share the word, the gospel. I bend things back to the gospel. And that's why, yes, Carrie, Sarah Myhill, that is it. Yes, 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 yes. That is her. Thank you. Sorry, I'm just reading, but to get back, I bend things back to the gospel because the gospel is the truth. And so if it doesn't align with Bible teaching, then a red flag goes up in my head or my heart, where the Holy Spirit helps me, guide me, counsels me. And when I don't feel very good about something, I get a weird feeling, a really weird feeling. And that encourages me to go look something up, or it encourages me to ask questions. I even ask you guys, like, hey, where did you read that about blah, blah, blah? Because I've never seen that. Help me, teach me. You guys, we're all teaching each other, okay? I've had a lot of education. I'm not going to lie. And so sometimes maybe I do know something that's more relatable and I can help you through things. But honestly, you guys, we have the internet now. And we're not, as doctors, hiding books from you anymore. Doctors used to do that, I'm sure, is hide their books. There were only doctors could buy medical books. And we had the privy to all of the knowledge, and you had to come to us. We held this blanket over your head that you had to listen to us. It was so paternalistic. Maybe not when I was there, but I think back maybe there was a time period from Little House on the Prairie to modern 2000s where we had doctors who, I don't know what I'm trying to say, but when I think from doctors back in the days of I always want to say Little House on the Prairie, because you understand where I'm going to. Back in the carriage days when, the doctors would come to your house and they would treat you and they just wanted you to be well. They weren't hiding things from you. And then we went through a stage where only doctors had access to medical books, and we would keep it from you. You have to come to us. We know it all. We're the know-it-alls. That's paternalistic. And now we're in a wave of where we got the internet, and you guys are starting to be as educated, if not more educated than your doctor. And now doctors are taking offense to that. And now they're going back into this paternalistic way of being your doctor, meaning what I say goes. And if you don't like that, go find somebody else. They don't care about losing you as a patient. Think about it. When COVID was here, if you did not get what they think you should have gotten, they dismissed you from their practice. And they could legally do that. They didn't have to they could put a sign on the door. If you haven't gotten this, you can't come in. You didn't have to give them 30 days of emergency treatment. Nothing. You could just say, go to ER. And that was legal. That would be I mean, you understand where we're going with this. Is doctors were given that right. That is not how I learned about the Hippocratic Oath. That it just wasn't ethical to me. When patients were coming to me and they would call first, hey, we just got kicked out of our doctor's office because we didn't have the thing. Will you still see us? We got, I need my blood pressure medicine refilled. Yeah, come on in. Whether you had the thing or didn't have the thing shouldn't say whether or not you can come to my practice or not. It blew my mind. I couldn't believe it. In fact, the first ones that started coming in, I said, you're lying. You have to be lying. That cannot be happening. Because I'm on my own, you see. I had no idea. I can't believe it. Mace says, you're 100% right. Doctors just don't have the time. I'm put in the too hard basket, Australia. It's in America too. Macy, is it Maceo? Or is it Mace O'Brien? I'm going to go with Mace O'Brien. So hopefully I'm not messing it up, but yeah, you could be, you're a problem child for them. They want easy stuff. They want you in and out and gone. And they really don't want you to come back because they have enough people. There's so little care out there that they could just dismiss you and you're like a dime a dozen. The fact that you're human and you walk the earth and breathe the air and drink water, yeah, you're a dime a dozen. They don't need you. It's unfortunate. Kendra says, it's hard to tell if doctors don't know the answers or just don't care. I've seen plenty of both types. I have seen I've seen both types. And sometimes I believe that they're related. The fact that they don't care makes them completely uneducated. They don't want, they feel so safe because if they follow the guidelines, you guys, if the doctors follow the guidelines, the likelihood of them being sued is very low, as long as they followed the guidelines. So you could see where it was not in a doctor's best interest to say, follow a carnivore diet and we can reverse your diabetes and get you off of medications. That is not in the guidelines. And a doctor could get sued for that and lose their license because that's not guidelines. So in a way, you can't blame the doctor. I mean, no doctor wants to lose their license. And I don't think they mind having a condition of ignorosis. They want to keep their medical license because they've learned that they make a certain amount of money and they can spend a certain amount of money. And they don't want to lose that income. That's one reason. Two, they may not care. They're fed up. They're already broken and they're just going through the motions until they can retire. Flozana says, I have so many health issues. There's eczema, seborrhea, more importantly, a 30 BMI, fatty liver, abnormal ALT, well, that's fatty liver, chronic inflammation, stiffness, pain, one knee, same in the elbows. Flozana, listen to Carrie, September. Hummingbird says, I'm vegan and have super low ferritin. What are your thoughts? Ferritin, if it's super low, okay, let's just have a teaching moment on a vegan versus, okay, let's just talk about a vegan diet. A vegan diet supplies only non-heme iron. There is no heme iron in your diet. Heme iron is easier to absorb. Non-heme iron is very hard to absorb. Okay? Very, very, very hard. Maybe 3%. Heme iron, which comes from animals like red meat animals, the ruminant meats that I talk about are bison, buffalo, sheep, lamb, cow, deer. Those are ruminant red meat animals full of heme. Dark chicken meat, heme iron. Dark turkey meat, heme iron. But a vegan diet has no heme iron. So you're trying to extract out enough non-heme iron to supply your body, which you absolutely need. Okay, you absolutely need iron for your body to work. You cannot survive without iron. But what happens is if you are consuming so much non-heme iron and it's not usable, some of it can get trapped in organs. Some, if not all, can get trapped in your organs, in cells. When non-heme iron gets in these organs, inside the cells of the organs, it causes oxidation. Oxidation. It causes rusting. So hummingbird, the very fact that you're looking at a low ferritin, I need to know what your transferrin level is, what your hemoglobin, so a CBC, a ferritin, transferrin, a TIBC, and iron saturation. I would need to know all of that because Hummingbird, thank you so much for being here. And I'm so proud, and you are such a brave person. But the very fact that you have all of this non-heme iron, it could be causing cellular damage. It's in everybody, because not even just because of vegans, because people eat a highly processed food, they're actually eating synthetic iron, which is non-heme iron. Non-heme iron is in anything that's fortified. Non-heme iron is in every plant. And so because we can't use non-heme iron very well, we also have difficulty regulating where it needs to go. And so it can get trapped. And so if a doctor sees you having low ferritin, their first thought is you're iron deficient. And then they will give you synthetic non-heme iron. We just fed you, we're feeding you more full of non-heme iron. You initially could feel better because you're trying to extract any type of iron that you can use. And so it's going to take more and more of that. But as you're trying to extract only 3%, so you have to give 100% to get 3%. I know I'm making this up. You have to eat a pound of non-heme iron to get what you need, when only a person eating a one red 16 ounce, well, not 16 ounces, that's a pound. How about you need 10 pounds of non-heme iron to extract 1 pound of a ribeye? Heme iron, which is more usable, it's 30%. So the fact that your doctor gives you more non-heme iron, you're worsening your problem. You are oxidizing even more in your body. It's aging you. Your cells are dying faster than they should. Hopefully that helps you understand. Your red blood cells are also likely, well, you know what, you could be B12 deficient. I don't know if you're taking B12. If you're B12 deficient, your cells will be megaloblastic. If you're completely have microcytic cells, you are considered, microcytic means small red blood cells, and we translate that to anemia, but anemia doesn't always mean low iron. You might have iron overload in the presence of iron deficiency. You have iron non-heme overload, non-heme iron overload in the presence of heme iron deficiency. And you're going to hit a breaking point at some point, okay? And not many doctors know how to look for this. Not many doctors know how to get a ferroportin level. Not many doctors know how to get a hepcidin level. Not many doctors know this. Do I completely know it? No, I don't. But I have seen this situation play out. And at first, people think on a vegan or vegetarian diet makes them feel like $1 million. And I understand why. Because usually going from a processed food diet, a standard, I call it a standard American diet or a standard processed food diet, any diet that you go to, keto, ketovore, carnivore, vegan, vegetarian, you will feel amazing until you don't. And it could play out over years and you don't know how sick you're becoming. Okay. Yeah, Flozana, talk to Carrie September. Yeah, Jack, I'm sorry about that. Your doctor's only spending 10 minutes. That's average. Actually, 5 minutes. They need to see well, they're seeing 40, 50 patients a day. Do you think that they have time for Jack? No. Yeah, Flozano, maybe you want to consider a consultation. We can go over everything. Yeah, Jack. Hard to find new doctors. I imagine. I know that online doctors can't listen to your heart or look in your ears or do those sort of things, but you could use those urgent care doctors. You can use them, and that's not abuse. They're there for a reason. Use an urgent care doctor and use your urgent care stuff, and then be your own and get educated online. Be your own doctor. Carrie says, my doc nearly fell off his chair when I asked for a ceruloplasmin test. Knowledge is power. Absolutely, Carrie. You ask them for a ceruloplasmin and they wouldn't even know that was like foreign language to them. They thought you were speaking Japanese. It's amazing. But yeah, ceruloplasmin level, get an RBC copper level, get a vitamin A, get a vitamin D. Those are all additional tests that I would suggest. And Carrie, thank you for bringing that to my attention. I appreciate that. Oh yeah, Jack. Cast iron, that is another source of non-heme iron. So too high of iron and too low of iron, or excuse me, too high ferritin and too low ferritin are conundrums, and they are a problem. Okay. Green. Gosh, I feel for you, Green Jewel. Green Jewel says that grief affects the body and is causing some inflammation. I'm guessing a lot of inflammation. Lost both parents and both pets in less than a year and in the process of moving. How can I care for my body despite all going on? One step at a time. Green Jewel, what you're experiencing right now, I mean, this is my co-host, Tucker. Many of you know who Tucker is. Many of you who are new did not get to experience Tucker as my co-host in person, but now he's my co-host in heaven. And I know what you're going through. I do. I empathize with you. I've lost my dad. He meant the world to me, and Tucker meant the world to me. So I know what you're going through. And I just took one step at a time. And sometimes I would go 2 steps forward and 1 step back. But learning about why I deal with grief, so you deal with grief differently than how I deal with grief. Or I deal with tangled emotional messes different than you deal with tangled emotional messes. Knowing why you react the way you react helps so much. Find clarity in your mind, and it helps you to process it and to move forward. Your body is inflamed. Your blood sugar is high. Your insulin likely is high from the cortisol, from high sympathetic tone and low parasympathetic tone. So you can work on exercises that will increase parasympathetic nervous system. So look up parasympathetic nervous system exercises and try to get these balanced out. Right now, you are very high sympathetic tone, very high use of sympathetic nervous system, and it's causing a lot more grief, a lot more anxiety, a lot more inflammation, a lot more trouble with sleep, a lot more trouble with brain fog, a lot more trouble making decisions. It will be okay, Green Jewel, but you need to learn about you. And therapy helps a lot. It helps tremendously learn about you. Reading books about you. Reading books about your parents. Finding out why am I why am I so in love, or so, the loss of a pet is so much harder on me than my neighbor who lost 3 and just gets another dog. Everybody is different. Everybody processes differently, but knowing how you or who you are helps you to kind of make a diagnosis of yourself. And then it's so relieving to know, well, this is normal and this is why, and I'm okay. Right now, you're at a position where I think I'm just putting words in your mouth, but you feel like it's all your fault. And that's where we fall into a sabotage. But somewhere along the line, you felt like maybe you were parentified, or maybe you were engulfed, or maybe whatever it is in your childhood is you're hyper vigilant. But just knowing that Green Jewel gets on here and says, I'm hurting right now. I'm really hurting. And I understand. I get it. There's a lot of people hurting, and a lot of people will hide that. And, they try to toughen it out, but that's another diagnosis in and of itself. Why does that person hide it? Why is that person suppressing or repressing or whatever they're doing? There's mental health and grief. It's difficult. And we go through the stages of grief and dying, death and dying, Kubler-Ross's stages of death and dying. There's 5 of them. And sometimes we have to actually jump to acceptance first so we can work backwards. So you accept that these are all bad things and this is what happens. I'm going to accept. I accept. Now you got to work backwards and say, I'm going through anger right now. Well, it's not anger because you couldn't accept it. You've accepted it and you're angry, but let's work through that. Why are you bargaining now? Why are you sad now? All of these things are reactions of how you were brought up, Green Jewel, and you learned how to deal with your level of reactions. And that's why everybody has a different emotional reaction. It's not that it's bad, but if once you know about yourself, then it's so much easier to feel like I'm okay with me. I'm okay with these grief reactions. I don't have to get stressed. I don't have to not sleep. It's not my fault. I don't have to feel like this. It's not your fault. Okay? Finn says, I have trouble sleeping, always have. Recently, I've been having auras and seizures when I close my eyes at night to sleep. I'm hoping that you've seen a neurologist. I'm sorry to hear that you're going through those things. Oof. Patriots or Broncos? Oof. If I tell you that I'm kind of on does it matter to me? They're not my teams. But that is going to be that would be a good combination, a good game. I don't know. I'm sorry that Bo Nix is not in it anymore. But he's a youngster, and he could take the Patriots. It's going to be I don't know, Arnell, but thank you. Lixa, thank you very much for the gift. I appreciate that. Give you a little heart here. Carrie says, I'm not a doctor, but I got so sick, researched, but sugar causes the inflammation. And so Carrie went carnivore and solved many, if not all of her problems. Be your own doctor, 100% correct. I get my own blood work online because doctors won't even order your labs. You ask them for it, just like Carrie asked for a ceruloplasmin, couldn't get it ordered. Doctors won't order it. It's almost like they feel like they can control you. So if you have the money, go order them on your own. I will order your labs for you. No insurance will not pay for them, but if you want to check the cost I get with the cost you get, Jack, sometime, just tell me what labs you want have ordered. If you guys don't know what to order, email me. I'll give you a list of what I think are good labs. Okay? yeah, it could run you $400. If you have that money and are willing to spend the $400 on your labs, get them. You need to be in control. But if you don't, beg and plead for, I would go to 15 different doctors to get 15 different tests if I didn't have the money so I could use my insurance. Hey, can you order me a insulin level? No, I won't. I'll go somewhere else. Would you order my ceruloplasmin level? Oh, yeah. I know about copper. How about a copper level too? You want that? So you might be surprised on who will order what for you. Okay. You're very welcome, Green Jewel. Thank you for sharing that with us. That must have been difficult. And you know what, though? I'm going to be honest. Sometimes it's so much easier to do it online to a bunch of people you don't know because you can't get the empathy and compassion or whatever you need. You're not getting it from somebody around you. That's what the sad part of this is you don't even know where to turn. And so you will put this information out there in hopes that you will get somebody who will at least understand what I'm going through. And there are a lot of people out there like that, okay? They're very empathetic. They can almost feel your pain. And those are the people who likely help. And so sometimes getting in these groups like on Facebook or other, I don't know where else they're at, but getting into grief groups where you can all talk about it together. If you have certain diagnoses or thinks that your parents have certain diagnoses and that's what led you to this, then you join that group. You know, if you think I got, a codependency, you got symptoms of codependency, then you join a codependency and you work on ways that you develop boundaries. There's a lot that you can glean from being in these groups of people who have similar issues as you do. Certain life experiences as you do. They're not issues. Well, I mean, you could call it an issue, but it's a life experience. You're going through a life experience and a difficult one at that. If I lost 2 of my pets and my parents, yeah, I might not be doing Saturday live streams. I don't know, but that would be difficult. Yeah, Roadrunner, I've heard that too. If you ask for your doctor to do something, they will usually, and I mean, what is that called when, I could go into all these psychoanalytical analysis on these people, on these doctors, on people in general. It's almost like I walk into the grocery store and I can diagnose people by the way they walk. But yeah, you're starting to see it. And Plow Money is an American living in Sweden. How's that going? I've never been to Sweden. Yeah, you have to fight your doctor for blood work. Isn't that a shame? All they have to do, Jack, just maybe, try taking in a form with you. And it's basically a form that gives them absolutely no responsibility for interpreting the results. Ask for them. And here's the form that you can sign, doctor. I'm just asking for these. I release you from any responsibility to interpret them. I will interpret them. Have them sign it, you sign it, and they put it in your chart, and then that gets them off the hook. That might allow them to order your labs and not feel bad about it. But here's another thing, Jack. If they are part of a big corporation, they get incentives for not spending money. And so if you're asking for $400 lab tests, that's going to come out of, could come out of their pool. And if the pool is depleted, that means they don't get an incentive. That is sad. Now they're not worrying about Jack, they're worrying about their pocketbook. That is very sad. Yeah, Jack says Facebook has support groups for everything. I thought so. You're very welcome, Jack. Hopefully that helps. Okay. Did I miss any questions? I don't know if I've missed any questions. On Instagram. Gosh, we got a lot of people joining today. I'm so happy to have all of you guys here. And hopefully you will find that the information that I provide brain stimulating to you that you might want to share with a friend, a family, a coworker, that you will hit the thumbs up, that you will hit the heart button, the like button, the subscribe button, that you will, consider super chats and subscribing to the channels to support the channel, all of that. Like Patrice, thank you so much for the super chat. Patrice is seeing a kidney specialist on Monday. Please advise what blood tests or other diagnostic tests I should request from the doctor. Patrice, if you email me at IronLadyDoc@AOL.com, I will send you that list, okay? But please just email me and at IronLadyDoc@AOL.com. It's pinned on Lucy's comment. If you could do that, I would really appreciate it. And then I will get that to you, okay? I will get that list to you. Anybody else? Honestly, if you need a list of labs, it doesn't cost me, it takes me 5 minutes. I'll copy and paste and I'll send it to you in an email, and you guys can ask your doctor. And honestly, if your doctor doesn't order them and you just need, 1 or 2 or 10 labs, and you say, Dr. Jensen, can you just order for me? I know that they're going to cost me, but I'm willing to pay. Great, I'll order them. You do not have to hire me to review those labs with you. I'm not requiring you to do anything. You're asking me to send in a lab. I want you to have the labs that you want. Unfortunately, I don't accept insurance. They don't accept insurance, and it will cost you. If you're willing to do that, awesome. Just email me. I'll send you the lab list, okay? That takes me 5 minutes. Kimberly, I don't know why your post is grayed out. I don't know if I can see it or not. So if you have another question, or if you have a question, please state it and I will watch for it. Sasa, or Sasha, Sassa, Sass. How about let's just say Sass. Please give dementia vitamin food recommendations at age 65. Milk is the new brain killer, I'm hearing. Well, dairy is very inflammatory. Dairy could cause in you a lot of complications, and getting rid of dairy might be in your best interest. If you are pre-diabetic but controlled, you have to undo the pre-diabetes. You're basically diabetic. There is no real pre-diabetes. You're either diabetic or you're not diabetic, okay? But Sass, you need to stop the things that are causing your pre-diabetes. Diabetes is carbohydrate toxicity. It is carbohydrate toxicity. If you had alcohol toxicity, do you continue to drink alcohol? No. If you have celiac, do you continue to eat gluten? No. If you have diabetes, why do people continue to eat carbohydrates? It is beyond me. There are no supplements you can take for your dementia or your cognitive dysfunction, your cognitive decline, your brain fog. There are none. Get rid of what's causing the problem. Your brain is in a fog because all you're giving it is glucose. And then when it doesn't have glucose, you give it more. And you are pre-diabetic, which means you're insulin resistant, which means you have diabetes. And diabetes is a disease of carbohydrate toxicity. Get rid of those and then start thinking about your vitamins and minerals after a year's time of letting your brain basically get detoxed. It would much rather have ketones than glucose any day. But all you're giving it is glucose. And your brain is insulin resistant. Your brain is diabetic. Your brain is diabetic before any other part of your body. It's an unfortunate thing, but you got that going on for you, okay? So I encourage you to make some changes. Forever Cowgirl says, Dr. J's lab order is low cost and affordable out of pocket. Thank you. Thank you, Forever Cowgirl. That means a lot. Melanie says, what tests are recommended before diagnosis of Hashimoto's hypothyroidism? I would get a TG and a TPO. In addition, I'll just name them off. A TSH, a free T3, a free T4, a reverse T3, a TG, and a TPO. So six different ones that I think that you should have in order to see whether or not you have hypothyroidism. And if you have antibodies, the TG and TPO will indicate Hashimoto's. I would get them both. Don't just get one. Jim Rat says, I've always ate lots of dairy and never had a problem. Eat sparingly and work out daily. Drink lots of water. Jim Rat, some of us do not react to dairy like others. Even if you're going to do dairy, maybe choose raw dairy, maybe choose A2, like the Jersey cows, instead of A1 milk. But it sounds like SAS completely needs to get rid of dairy, at least for a while, and clean out. Okay? Clean out. Paulie says, finally someone said it, was immediately discharged from the Army for okay, so you had onset of diabetes or diagnosed diabetes type 1 as an adult. Yeah, and so you had a seizure, which was probably due to the bad, the electrical system in your body because of the type 1, because of hyperglycemia. That probably triggered a seizure disorder. Yeah, you were immediately discharged. It's not the end of the world. At least we have insulin available to give to you, but the least amount of insulin that you could give yourself is most important. So you might have had a LADA diagnosis, LADA, as your diagnosis. Gosh, I'm glad they found it. You wouldn't want to have had a seizure driving or in, frontline when you were, sent off to fight in a war. That, anyway, Paulie, thank you for your service. And yeah, hopefully you've got a real good doctor and you're starting to eat less crappy foods, okay? Or no crappy foods. Lori says, my grandmother on my dad's side lived on just coffee for the last 4 years of her life that I know of. She died at age 94. Lori, just out of curiosity, did your grandma have a lot of body fat on her body? Or was she, yeah, let me know. I'm just trying to piece this thing together. Jack says, are there any sweets that are acceptable? What do you want me to say? The answer is no. Dates like Larabars, no. My understanding is that dates don't spike blood glucose. Jack, what nutritional value does a Larabar or a Lava Bar or whatever bar that's processed in order to hold all the things together? Do you not think that is a processed crapola diet? Yes. No. Sweets, in my book, are acceptable. If you were to just eat meat, eggs, a proper human diet, you would find out how sweet your steaks taste. When I started eating meat and butter and bacon and eggs, when I walked into my house, I could smell the sugar from the meat. It's an amazing thing to get away from glucose. We don't need it. Our body makes it. It makes just enough. I'm eating enough beef, butter, bacon, and eggs. I don't eat much bacon. I eat it, well, it's enough though. It's enough for me. I eat enough ruminant red meat and a little bit of chicken, a little bit of sardines, and some liver that I don't need any sugar. I don't need carbohydrates. They are not essential. My body is making them, okay? So you have to ask yourself, Jack, you say, Jack, to yourself, are there any sweets that are acceptable, Jack? And answer it back. Talk to yourself. Oh, Polly, thank you. Please share. If Polly says you're absolutely correct, I love this so much. Extremely wonderful to hear the truth. Polly, you're very welcome. And there are many doctors out there that you need to, to hook up with and to start listening to some of the things that they're talking about. Yeah, Lori, your great grandmother lived on a 9 wide, 1 centimeter tall biscuit and buttermilk her last 3 years of her life, and she died at 87. It sounds like she had a most wonderful life. I mean, was she happy eating the biscuit and buttermilk? I mean, sounds kind of beautiful, doesn't it? She probably was stress-free. She loved her family. She smiled and laughed and just loved life. That wasn't about her diet. It was about God. She probably had Jesus overflowing her heart, and he didn't care what she was eating. Kimberly says, on 6 heart meds, heart attack due to blockage from AFib issue 2nd of June ago, 2 Junes ago. Well, your blockages wasn't from the AFib. Your AFib might have been caused by having the blockages, but not likely the other way around. Do I really need all these medicines? Well, I'm not your doctor, Kimberly. I don't know what you need or don't need. Hopefully you have a most wonderful cardiologist that can walk you through. But I do believe there are, Kimberly, there is a book that you should maybe consider reading about the author's name. He's a chiropractor. It's Stephen, Stephen, I believe, Hussey, Hussey. And I think you would find that very informative. Okay? I think you would find it very informative. But you have to ask yourself what plugged up your arteries and not continue doing that. Okay? So Lori, your grandmother was not overweight. I don't know how she survived on coffee, because once the body fat disappears on our body, we go into starvation and we start, we cannot make fatty acids. We cannot make ketones as an energy source. So she might have been getting something from somewhere, okay? Yeah, Mike, I don't know much about that you're asking about. Okay. I read online to discontinue Tylenol for acute pain management after 10 days. True or false? I would say true. We shouldn't take anything over 10 days for pain management. If you still have pain, you got to look into other things. I slipped on the ice, fell hard on tailbone last week. That's going to take a long time to heal. You're on day 8, 1800 to 25. So Tylenol is, I don't know what your liver function is. I don't know what your kidney function is. But I'm doubtful that Tylenol is doing you any good. I would start using a heating pad of moist heat. I would use ice, and I would alternate. I would sit in Epsom saltwater baths. I would use some sort of padding to protect my tailbone. I would just be extra cautious and let it heal. Whether you have a fracture or a bruise, I think the treatment is the same. And Anne, I am sorry that you are experiencing this, but it will get better. But continuously taking medications might not be in your best interest, but doing these other remedies might help. Okay. Yeah, Lori, both of them were thin. I'm curious, were they lovers of Jesus? $19.10. What do you want me to say? The answer is no. Nothing is acceptable. $19.10 is more blunt than I am. I really can only answer for myself. Are Malea, Dr. J, are there any sweets that are acceptable? And I would, if I was answering myself back truthfully, which I usually am, no. if you want glycation, then eat the sweet. What is glycation? It's aging. I'm trying to slow my aging down, not advance it at incredible speeds. So the less glycation I have occurring in my body, the less oxidation I have occurring in my body, the slower my aging will be. Okay? Glycation is anytime we spike glucose. Well, anytime you take in an acceptable sweet, you're going to spike your glucose. And that glucose is going to attach to proteins in your body. That's called glycation. Sugar plus a protein is called glycation. And the sugar gums up this protein that we need. We have proteins all over our body in every cell, and we need them. This sugar messes up the function of these proteins. They can get misfolded. They can be damaged completely. There's a lot of things that can go on. So I choose least amount of glycation possible. All right? But you guys can do what you want to do. Okay? That's yeah, Lori, it sounds like they were just living for the Lord. And their day was to go at 87 and 94. That's what God, that's the relationship that these people have. And she could have drank coffee and she could have drank mud water, not the mud water, but she could have been outside eating mud in a glass of water and probably lived the same way. Okay. Clot made from AFib, they said. So, okay, Kimberly, I thought you said that you also had blocked arteries. So the blocked arteries was not plaquing. It was from the clot. Again, Kimberly, even more reason for you to read that book. I can't even remember the name of it, but he's a chiropractor. His name is Stephen, as in Stephen Hussey. He's a chiropractor. And I didn't believe everything he talked about, but there was a lot I gleaned from it. Just put it at that. And it might help you think about why. But yeah, your AFib through a clot. But why was your electrical system off in your heart? Somewhere along the line, you were very, very inflamed. And the electrical system got off, not the muscular system, the electrical system. That's the rhythm. So you went into a not normal sinus rhythm. You went into AFib, atrial fibrillation. So your electrical system was off. So it starts beating, not bump, bump. It's all over the place. We call it irregular heartbeat. It's not even regularly irregular. It's irregularly irregular. That's AFib. So your atrium and ventricles were beaten way out of sync. And so blood was stagnated, it clotted, and then on one of the beats, it goes poof, and threw a clot into one of your, into the arteries, and yeah, you had a heart attack. And so maybe you're on a defibrillator now. Maybe you got a pacemaker now. Maybe you're on medications for AFib. I don't know. I would be happy to consult with you if you wanted to run through a bunch of stuff, but Sass says, I'm helping a friend who got shingles, no vaccination, then Bell's palsy. So we have some things going on. Bell's palsy could be caused by a nerve too, or excuse me, could be caused by a virus too. Like shingles is caused by a virus. A droopy face, which is common with Bell's, okay. Doctors giving steroid shots, gabapentin after recovery. It all began again. Opinion, please. Did your friend take high dose Valtrex for a few days, valcyclovir? If it's viral, sometimes valcyclovir can calm it down. I'm guessing this is an acute thing. They're in and out. You may or may not recover from a Bell's palsy, but I would be on the lowest inflammatory diet I possibly could and calm down all of the inflammation in the body. Yep, that's what I figured, Kimberly. AFib created a clot. Clot traveled to the tip of a small lower area of the artery, and it usually occurs where there's a bifurcation. most all these injuries occur where there's a lot of turbulence. So right where the bifurcation occurs is a lot of times where that happens. And you know, the LAD, so the left anterior descending, the right coronary artery, the circumflex are the main arteries where these things can occur. Jack, I think those are maybe decisions that you would have to make. I know what decisions I would make, but I can't answer them for you. Yeah, Kim, I mean, gabapentin can have its problems as well. I understand. But maybe for a temporary thing, I don't know, maybe for temporary, it, you know, maybe it's worth it to some people. Okay. Gazelle, I do not do any live requests for videos, so thank you though for wanting to do that, but I don't do that on Instagram. If you guys noticed, if you're on Instagram, I do have a live fundraiser for Rescue Rehab and Rehome. That is a rescue here in the Des Moines area that I support, and that's where I got my Norman tallow. He came from Norman, Oklahoma, and I rescued him from there. And that's why I'm supporting them. So if you see that on there, it's not a hoax. It is, I actually put that there because I tried to raise money for them every month. Every month I do that. Yeah, Kelvin, anytime you smile, you're being good to yourself. Let's see. Oh, good, Kimberly, that's awesome news. So she went through a shock. She went through an ablation procedure, and now she's back into normal sinus rhythm. So you have new life. You have new life, Kimberly, and I think there's some changes that you can make. I really do. Jack, you're very welcome for being. I appreciate you being here. Kimberly, 56, size 10, women's, considered obese, 5'3". I can't get smaller without starving. Starving means you are hungry, because if you were eating satiating food, you would have less hunger. Starving, by definition, I know we use that term lightly, but starving by definition means you no longer have any fat on your body. And from what you've discussed, you have a lot of fat on your body because you're considered obese. So you cannot, by definition, be starving. Starvation means you have no fat to make fatty acids, which make ketones, which is an energy source. So you are hungry. The reason you're hungry is you're probably eating carbohydrates which spike glucose. Glucose spikes insulin. Insulin drops your glucose to lower levels where you don't like it. You get hungry, you eat again. And for sure, at 5'3", you can't get any smaller because you are hungry all the time. The reason you're hungry all the time is because your insulin level is very, very high. In order to get the insulin level down, you have to stop eating carbohydrates or lower them tremendously, significantly, okay? You guys, we will call this a day. I don't see any further questions. I appreciate the super chats. I appreciate the super stickers. I appreciate your thumbs ups and your subscribes and your comments. I'm thankful for all of these things, okay? I will be back, Lord willing, I will be back tomorrow, Sunday at 10 a.m. Central, okay? And Kimberly, we can talk about this tomorrow if you're back, or you can sign up for a consultation. Consultations, I'm not trying to hide this from you. It is $110 for an hour. So it's $110 per hour. If you would like to sign up and go over things, I think that is a reasonable cost. Many of you who are listening have done consultations with me, and I think you found them valuable. That's the impression I got. So you can email me at IronLadyDoc@AOL.com. And Ryan, please, thank you for the prayers. I love to have people pray for me, and I love to pray for people. So 1910, you're very welcome. And with that, we will call today and be back tomorrow, Lord willing. So you guys have a blessed Saturday, and we'll see ya.